because we typically think of lung cancer in smokers. What are the chances, if you're a non-smoker, you can get this illness?
Well, it's relatively infrequent. About 1 in 10,000 non-smokers get lung cancer. Overall, about 10 to 15% of lung cancers that occur in
Environmental
risks of lung cancer are, air with a lot of toxic chemicals and particles in it. But usually that risk is breathing air like that over long periods of time. We don't generally think of one exposure like that so much in that way. But, of course, radon is a high risk factor. That's an odorless radioactive
right up there
as the next cause of cancer. And radon is this completely odorless, tasteless gas. It's radioactive. It's generated out of the earth, and it accumulates under some houses. And so it's pretty important to have your house and your environment checked for radon, because there are ways to put systems under the house to blow the radon out and reduce your risk.
Let's talk about what people should look out for, symptoms. We've got the cough that doesn't go away. That's probably a really common one. What else should people worry about?
The other thing is that coughing up blood, and that's a tricky one and a complicated one. It's scary when it happens. Similarly, weight loss is a very common one, a loss of appetite and doing poorly in that sense. These are all, signs in general, but it can be very subtle. Your best hope is that you discover lung cancer early. So it's a solitary nodule, there's no spread to lymph nodes, and in that situation you can remove it surgically and there may be nothing else to do. If it has spread further, then you may need some chemotherapy in addition, or you may need radiation in addition to try and cure it. And of course, once it's spread outside of the lung area, or if it's very advanced in the regional areas, it's often not curable. So as we were pointing out earlier, finding that nodule early on is your biggest thing that you need to be doing.
Cigarette smoking remains the leading preventable cause of death in the United States, resulting in an estimated 1 out of every 5 deaths each year. In addition, smoke from tobacco is the main cause of lung cancer, which is the leading cause of cancer deaths among both men and women. Mortality rates for lung cancer are highest among African American males. In addition to lung cancer, did you know that smoking also increases your risk for other cancers, including oral cancer and cancers of the throat, pancreas, kidney, bladder, and cervix? Furthermore, people who smoke are significantly more likely to suffer a heart attack than people who don't smoke. Smoking also causes most cases of chronic obstructive lung disease, which includes bronchitis and emphysema.
Cancer surgery, the consequence for no surgery is progressive cancer and death. So I figure that the reasons for not having an operation ought to be pretty darn good. If you're in a situation where people are communicating and they're uncomfortable with each other, there then are factors that break down and that the patient doesn't end up doing what they should. So you somehow don't have that communication go right, and the patient doesn't really understand what's going on, and then the mutual decision in these patients who are kind of sick is no surgery, because neither feels comfortable with each other. So you go back to your primary care doctor, and the primary care doctor says, well, what happened when you saw the surgeon? And the patient tells him, and the doctor says, whoa, we need to take another look at this. But if you don't have a primary care doctor, you lose that bit of a safety net, and then you drift out into space and never get the operation. We've come to the point where we've depended on publications in the medical literature that show, yes, there are racial disparities, and we're counting on goodwill to correct it. Well, it's been 20 years now, and it hasn't corrected it yet.
Has there ever been a time that you have felt mistreated by the healthcare system?
My mother went to the doctor, and they told her, well, there's nothing really wrong with you, take some Maalox. Well, she went home, took the Maalox. And a couple of days later, it was still the same problem. She went back to the doctor and said, take some more Maalox. I had to wake up with my mother dying. She had a heart attack, and there was nothing I could do about it because I didn't understand what was going on with her.
More than a third of physicians who are practicing today in this country say that when they go to work, they are seeing patients who are being treated differently, they think, because of race and ethnicity.
I want to come here to Dr. Bob and ask you the question again. Why has it been so difficult to recognize and to deal with these issues in our healthcare system?
It's really, I think, a lot more complex than simple racism. In my hospital experience, there were other groups that were treated in a disparate fashion too. So I think it becomes very complex, and I don't think we all as providers or actually as patients understand the dynamics really of which of these things is happening.
I think we're being just a tad too intellectual about this conversation. You know what I mean? We're talking big words, long sentences when it's basic and fundamental. If you're black or brown or yellow, when you're in a situation, that's what they see. Black, brown, or yellow. You could be the CEO, you could be a doctor, you can be a lawyer, but when they look at you, they don't see doctor, CEO, lawyer, they see skin color and money.
Studies show racial disparities among patients battling a particular type of cancer. I'm Jennifer Dodd, and this is a Daily RX Minute. In a study involving more than 1 million patients with early-stage non-small cell lung cancer, researchers found that race may have influenced how treatment was managed. In particular, the study found that African Americans were less likely than Caucasians to be treated with surgery for this type of lung cancer. Make sure and ask your doctor what the very best treatment is for you.